There are conversations many older men avoid for years, not because they're unimportant, because they're embarrassing. One of those conversations begins with something almost nobody expects, a change they notice in their semen. I've had countless patients lower their voice before asking me, "Doctor, is this normal?" Today I want to explain what I tell every one of them. I'm Dr. Alan Mercer. I've spent more than 35 years caring for older men, and if there's one thing I've learned, it's that the body sends us quiet signals long before it sends us loud ones. Some of those signals show up in places we're taught never to talk about, but silence isn't protection. Silence is just delay. So today, I want to walk you through the changes in semen that are usually nothing to worry about, and the ones that deserve a phone call to your doctor. By the end of this video, you'll know the difference, and you'll feel a lot less alone in asking the question. Let's start with something important. As men get older, semen naturally changes. This isn't a disease, it's biology. The prostate gland and the seminal vesicles are responsible for producing most of the fluid in semen. As men age, these glands slow down a little, the same way many things in the body slow down with the years. That can mean lower volume. It can mean a thinner consistency instead of the thicker texture a man remembers from his 20s or 30s. It can also mean a slightly different color from one week to the next, especially depending on hydration or how long it's been since the last ejaculation. I tell my patients this all the time. The body at 70 does not behave like the body at 30, and that is not a failure. It's simply a different chapter. Most of these small variations are completely harmless. But there are 5 changes that I want every man watching this to understand clearly because they can sometimes point to something that needs attention. Let's start with the one that frightens men the most. Change number 1 is blood in the semen. Doctors call this hematospermia. I remember a patient named Frank. Frank was 72 years old, a retired mechanic, married for 45 years. One evening he called my office, and I could hear something different in his voice. Quiet, careful. He said, "Dr. Mercer, I don't want to alarm my wife, but I noticed something in my semen tonight, and it scared me half to death." He described a pinkish tint, something he had never seen before. Frank assumed the worst. He assumed cancer. He barely slept that night. Here is what was actually happening medically. When we examined Frank, we found mild inflammation in the small tubes that carry semen, something called the ejaculatory ducts. This kind of inflammation can happen after minor irritation, a recent infection, or sometimes for no clear reason at all. It is far more common than most men realize, and in the majority of cases, it resolves on its own within a few weeks. What we did was straightforward. We ran a urine test, checked his prostate, and monitored things over the following weeks. There was no infection, no abnormal growth, nothing dangerous. The outcome was reassuring. Frank's symptoms cleared up completely within about 3 weeks, and he never saw blood again. Now I want to be honest with you because that is my job. Blood in semen can occasionally be linked to other causes. Sometimes it follows a prostate biopsy or another procedure. Sometimes it's related to an enlarged prostate, which is extremely common in older men. In rare cases, it can be connected to a more serious condition, including prostate cancer, though this is one of the less common causes, especially if it happens only once. The point isn't to frighten you. The point is this. If you see blood once and it disappears, that's usually nothing urgent. But it's still worth mentioning to your doctor at your next visit. If it continues for more than a few episodes, or comes along with pain, fever, or trouble urinating, that's when I want you calling sooner rather than later. Many of these changes have treatable causes. I say that phrase a lot in my practice because it's true and because fear has kept too many men from picking up the phone. Let's talk about change number 2, yellow, green, or foul-smelling semen. I had a patient named Robert, 68 years old, a retired school teacher. Robert came to me because he'd noticed a strong odor and a yellowish tint that hadn't been there before. He was embarrassed to bring it up, and he told me he'd been avoiding intimacy with his wife because he was worried something was wrong with him. Here's what was actually happening. Robert had a mild case of prostatitis, an inflammation of the prostate gland that can sometimes be caused by a bacterial infection. This is one of the more treatable conditions we see in men his age. The color and smell changes were his body's way of signaling that something down there needed attention. What we did was simple. A urine culture confirmed a mild infection, and we treated it with a short course of antibiotics. The outcome was excellent. Within 2 weeks, Robert's symptoms were gone completely, and within a month, everything was back to normal. I want you to understand something about color and odor changes. They are almost always linked to infection or inflammation, not to cancer. This includes urinary tract infections, prostatitis, and occasionally sexually transmitted infections, even in men who are older or in long-term relationships. These are treatable. These respond to medication. But they do need a doctor's evaluation because untreated infections can sometimes spread or worsen over time. Let's move to change number 3, pain during ejaculation. James was 77 years old when he came to see me. A widower, quiet, private by nature. James told me that ejaculation had become uncomfortable, sometimes even painful, over the past 2 months. He said he'd started avoiding intimacy altogether because of it, and it was affecting a new relationship he'd recently started, something he'd been nervous and excited about after years of being alone. What was actually happening medically was a combination of 2 things. James had some mild prostate inflammation, and he also had early signs of pelvic floor tension, something that can develop with age, especially in men who sit for long periods or who've had previous urinary symptoms. What we did was targeted. We treated the inflammation with medication, and I referred him to a pelvic floor physical therapist, which is something many men don't even know exists for men's health. The outcome meant a great deal to James. Over about 6 weeks, the pain gradually faded, and he later told me it had given him the confidence to continue building that new relationship. I want to mention something important here. Pain during ejaculation can also be a side effect of certain medications, including some blood pressure medications and antidepressants. If you've started a new medication around the same time the pain began, that's worth discussing with your doctor because sometimes a simple adjustment solves the problem entirely. If the pain is occasional and mild, it often isn't an emergency. But if it's persistent, worsening, or paired with fever or urinary difficulty, that combination deserves a prompt evaluation. Let's talk about change number 4, very watery semen or a sudden major change in appearance. William was 81, one of the sharpest men I've ever treated, still doing crossword puzzles every morning with his coffee. William noticed that his semen had become noticeably thinner and lighter than he remembered, and it had happened rather suddenly, over just a few weeks. Here's what was actually happening. William had recently started a new medication for his enlarged prostate, one from a class of drugs that reduces certain hormones involved in prostate growth. These medications are very effective for urinary symptoms, but they can also reduce semen volume and thickness as a side effect. What we did was review his full medication list together, confirm that this was a known and expected effect of the drug, and reassure him that it wasn't a sign of anything dangerous. The outcome was simple relief. Once William understood the cause, his worry disappeared, even though the physical change remained a normal part of being on that medication. I share William's story because gradual thinning with age, or after starting a new medication, is common and usually harmless. What deserves more attention is a sudden and dramatic change with no clear explanation, especially if it comes with other symptoms like pain, blood, or urinary changes. Hormonal shifts, certain medications, and prostate conditions can all play a role, and your doctor can help sort out which one applies to you. Now let's talk about change number 5, and this one surprises a lot of men. No semen at all during orgasm, sometimes called dry orgasm. Michael was 74, a retired accountant, and a man who liked precise answers. He came to me confused and a little embarrassed, saying that his orgasms felt normal, but there was little to no semen released at all. He worried something had gone seriously wrong internally. What was actually happening medically is called retrograde ejaculation. Instead of semen exiting the body normally, it travels backward into the bladder. This can happen because of long-standing diabetes, certain prostate medications, or previous prostate surgery, all of which affect the muscles that normally direct semen forward. Michael, it turned out, had diabetes that hadn't been perfectly controlled in recent years, which had gradually affected the nerves involved in this process. What we did was focus on better diabetes management together with his primary care team, and we discussed that in many cases this condition is manageable, even if it isn't always fully reversible. The outcome for Michael was mostly about peace of mind. Once he understood the mechanism, his anxiety eased considerably, and he felt empowered rather than frightened, especially once his blood sugar control improved. I want to emphasize something for every man listening. Dry orgasm is not dangerous by itself. It doesn't harm your body, but it's often a sign of an underlying condition like diabetes or a medication effect, and identifying that underlying cause matters for your overall health, not just for this one symptom. Now, let me bring together everything I've shared today because I want you to leave this video with real clarity, not more confusion. Semen naturally changes with age. Lower volume, thinner texture, and subtle color shifts are common and usually harmless. Hydration matters more than people realize because dehydration alone can thicken or darken semen temporarily. Medications, especially those for blood pressure, prostate health, and mood, can all affect semen in ways that feel alarming but are often expected and explainable. But there are moments when I want you to call your doctor without delay. If you notice blood in your semen that continues over multiple occasions rather than a single isolated episode, that's worth prompt evaluation. If you have pain that is persistent rather than occasional, that's worth prompt evaluation. If you develop a fever alongside any of these changes, that's worth prompt evaluation. If you're having difficulty urinating, whether that's a weak stream, frequent urges, or a sense of incomplete emptying, mention it right away. And if you notice unexplained weight loss, ongoing bone pain, or any visible swelling in the pelvic or groin area, please don't wait for your next scheduled appointment. Those combinations deserve attention sooner rather than later. I want to be clear about something, because I never want to leave a patient or a viewer more frightened than when they arrived. Noticing a change in your semen does not automatically mean something serious is wrong. In my 35 years of practice, the overwhelming majority of these changes have turned out to be manageable, explainable, and often completely treatable. Inflammation resolves. Infections respond to antibiotics. Medication side effects can often be adjusted. Even conditions like retrograde ejaculation, while not always reversible, are rarely dangerous on their own. What matters most isn't the symptom itself. What matters is what you do with it. The men I've seen struggle the most weren't the ones with the most serious diagnoses. They were the ones who stayed silent for months, sometimes years, carrying worry alone instead of bringing it to someone who could help. Frank, Robert, James, William, and Michael all had one thing in common. They were brave enough to ask the question, even though it was uncomfortable. And every single one of them left my office lighter than when they walked in, whether the answer was simple reassurance or a clear treatment plan. So if you've noticed a change recently and you've been sitting on it, hoping it goes away on its own, let this be your sign. Call your doctor. Describe what you've noticed plainly and honestly. There is no need for shame in that conversation. We've heard it all, and our only goal is to help you stay healthy for the years ahead. I'm Dr. Alan Mercer. Take good care of yourself, and I'll see you in the next video.